Welcome to another Ask Arlington. I'm Jay Warren. Ask Arlington is a show that is dedicated to answering the questions that you have about what's happening here in our city. And on this episode, we're focusing on West Nile virus and Zika and ways that you can prevent mosquito breeding here in Arlington. Now, each year, targeted ground spraying occurs following the recommendations of the City of Arlington Health Authority, Tarrant County Public Health, and the CDC. And here to help us answer some of your questions is Aimee Rockhill-Carpenter. She is the city's health services manager. And Aimee, thanks for joining us today.
Thanks for having me.
Before we get into our resident questions, and we got some good ones today, we appreciate everyone at home sending those in. I did want to touch base with you a little bit about and explain what people at home can do to prevent mosquitoes, because that's really the first line of defense, right?
Absolutely. In the words of Benjamin Franklin, an ounce of prevention is worth a pound of cure.
Yeah.
So we really want to promote that prevention part of it. Namely, we want to reduce breeding sites, so getting rid of standing water, cleaning out those drains around your house. So also we want to make sure that we are not storing any outside tire storage, things that would hold water if it rains and then become a breeding site. The other thing that we recommend people to do is wear long sleeve and long pants, lightweight of course, when they are doing outside activities such as gardening. And lastly, we recommend that people do apply bug repellent. Specifically, the best option would be going with a DEET-based bug spray.
Yeah. So as you mentioned, the things around your house to look for, it's amazing what a mosquito can actually breed in. And it is a very small amount of water. It's not just, a huge like kid's swimming pool that you might have full of water. That clearly could be a problem, but it could be as little as a saucer, right?
Absolutely. So if you have outdoor plants that have the saucer underneath for catching the water, you want to make sure that you're changing those daily. Also things like bird baths. Like I mentioned, the French drains, your storm drains around your house, storm gutters. Anything that could hold water potentially is a spot where mosquitoes could breed. Yeah,
interesting, and I could talk about this stuff all day long, so we need to get to our resident questions. But on the French drains, a lot of people around here do have French drains to make sure that their property doesn't get soggy and so forth. And I never thought about actually putting a dunk inside the French drain because there's standing water down there, right?
Sure. So what you can do is go to any local hardware store or home improvement store, and you can purchase these things called BTI dunks. And it is not a pesticide, it's not an insecticide, it's actually a bacteria that the mosquito larva breaks down and it kills the larva. What you can do with those dunks is break them up and put the granules into those drain areas where the water is standing, and then you want to do that about once every 30 days. Yeah,
smart. All right, well, there's lots of places around your house that you need to be looking for this standing water, and everyone needs to be on guard for sure. That's
absolutely
good advice. Well, let's get to our first question. It comes to us from Jackie. Jackie asks, why does Arlington not spray? Yes, I know they did last year, but only in a very limited area. I think the citizens would feel safer and with much earlier and larger areas of spraying. And I would think, Aimee, that Jackie's bringing up a good point, because some people want lots of spraying and some people don't want any spraying. So what is the philosophy here in Arlington?
In Arlington, we follow the Center for Disease Control's recommendations for mosquito prevention specific to disease-carrying mosquitoes. As you may or may not know, there's actually 85 species, known species of mosquitoes in the state of Texas. We are only concerned about those that have a public health implication, meaning that they are a vector for a disease that could make humans sick. So what we do is we set traps throughout the city. We send those trap sample results to the county and they test those results. When we receive a positive result from one of those traps, that is when we do that targeted ground spraying initiative. We want to be sure that we're making a real careful balance between the public health risk and not just spraying for nuisance mosquitoes. We always want to have that balance, so we're trying to make our city as healthy and safe as possible.
And your traps right now are looking at both West Nile and Zika, is that correct?
Yes, our primary focus for the testing is going to be the West Nile virus because that has a lab test associated with it. What we're doing for the Zika virus is monitoring a different species of mosquito. Like I mentioned, there's 85 species known. The species that is for West Nile virus is called Aculex quincunfasciatus. May or may not need to know that. The vector for the Zika virus is going to be of the Aedes family. So Aedes aegypti, Aedes albopictus, two different types of mosquitoes, two different types of traps and definitely a different surveillance method.
And one of the interesting things that I learned last year when we started talking about Zika was these mosquitoes actually bite at different times of the day. So you used to could say, well, dusk and dawn, but now it's actually all day long. You need to be careful to prevent both West Nile and Zika, right?
Correct. We're very lucky that we don't have Zika endemic in our area at this point. All of the cases of Zika that we've seen in the North Texas area have been imported from a travel case. Right. That being said, we want to prevent Zika from coming into our population of mosquitoes. We ask people that travel abroad in areas that are known to have the Zika virus that they wear those long sleeves, long pants, bug spray when they're traveling out of the country, and that they're also wearing bug spray. And when they come back, that they're really mindful that they don't start showing any symptoms of the Zika virus. If they do, they definitely need to seek medical attention right away.
All right. Good advice. Well, our next question comes to us from Margie. She asks, what can be done about a neighbor that has a pool that he doesn't keep drained? This has been an ongoing problem, she mentions, in her neighborhood, and I know other people have had problems with this, and this is something that the city can help with, right?
Absolutely. Thank you so much for this question. We do address this issue. This is our code compliance department can actually go and work those cases, but we need to know about those. So what we ask residents to do is either enter this information on our City of Arlington app. You can download that on your phone, enter in the complaint. The information goes then directly to that department who can send out a code officer to address that concern.
And that app is called the Ask Arlington app, both on the Apple Store and the Android Store, so you can get it right on your phone. So it's
Absolutely.
great. Yeah.
Or you can even enter on the City of Arlington website. You could also call the Action Center. So there's a lot of different methods that Arlington residents can get that information to the parties that need to go and look at that.
And we've got that Action Center phone number here at the bottom of the screen, so everyone's got that telephone number as well. So multiple ways, which is great. And we do want to hear from people because this is a great way to stop that breeding and being on the offensive against the mosquitoes, as you mentioned earlier.
Definitely want to do that.
Let's get to our last question. This comes to us from Christina. She asks, why don't you ever talk about the after effects of West Nile virus and what it has done since the horrible outbreak that we had back in 2012? And I know we talk a lot about West Nile, so kind of address her question, if you would.
So I think that this is an issue that is definitely discussed very much so in the medical communities as well as in the public health industry. We are concerned about these long-term effects, which is why we strongly advocate for that personal protection. We do not want people to be sickened with West Nile virus because it isn't just a small amount of time that these people are affected. It can have long-term repercussions, both anywhere from neurological issues, kidney issues, general fatigue and malaise. These issues can string on for years and years. This is not an issue that is being ignored by public health or medical communities.
And there are really kind of two kinds of West Nile virus, right? There's one that's more like flu-like symptoms and one that is the more neurological in nature from a layman's perspective. Is that accurate? That's
exactly right. So usually the individuals that are most affected by West Nile virus are going to be the senior population. And they're most vulnerable for that second type that you mentioned, which is neuroinvasive West Nile virus. That's when you unfortunately hear about people perishing from the disease. The less serious version, it's still very serious.
It's all serious, yeah.
Yes, is more of like a febrile condition where you will have a shortened and less severe symptom stage. But again, studies are now showing that even if you have that lower kind of threshold of the West Nile virus, you can have long-term health consequences as well. So again, we definitely want our residents to be looking for breeding sites, eliminate breeding sites if at all possible, report to the city when you see environmental conditions that are conducive to breeding sites so that the city can take care of those. We definitely want to advocate people to wear long pants, long sleeves, bug spray, anything that you can do to keep yourself and your community healthy.
Final question, and then we'll get out of here. But I understand because we had a mild winter, there have been a lot of people have asking questions of, okay, is the mosquito season starting earlier and is it going to be worse? Is there any way to predict that, or is it starting earlier this year?
We start and stop our mosquito trapping season at the same time every year, which is based on the county's testing frequencies. I wouldn't say that it's starting earlier for Arlington. We are going about business as usual. In April every year we start surveying, we do larviciding, and we definitely are on top of things from an early standpoint. The one thing I will say is that there have been North Texas samples of mosquito testing that have come back early positives.
Yeah.
So we've seen one in another North Texas city, as well as some of the Dallas County areas. And for that reason, I really do not know what the season has in store for us. It's hard to predict, but I would definitely say, again, prevention.
That's the key, because if it could be a worse season, then making sure you don't have the breeding grounds and so forth at your house, and you're wearing the bug spray and so forth is important. So very good. Well, Aimee, thanks so much for being with us today. Really do appreciate that. And we appreciate all of you at home for asking some great questions and sending those in, and for watching this edition of Ask Arlington. Be sure to tune in next time. We'll answer more of your questions on another Ask Arlington.